Hello friends, welcome to Impulse Physio. In today's video, we will be talking about the muscles of the hand. But before starting, if you guys have not yet subscribed to my YouTube channel, do subscribe, like, comment and share. Muscles of the hand. So there are two types of muscles. One is called as extrinsic muscles, another one is called as intrinsic muscles. Coming on to extrinsic muscles first. Extrinsic muscles are located in the interior and the posterior compartment of the forearm. So this is called as the interior compartment of your forearm and this is called as the posterior compartment of your forearm. Extrinsic muscles are located in the interior and the posterior compartment of your forearm. Coming on to the intrinsic muscles. Intrinsic muscles are located within your hand. So we will be discussing all the intrinsic muscles in detail. Total number of intrinsic muscles are 20. Now how? So let's count. Thenar muscles, these are 3 in number. Hypothenar muscles, these are 3 in number. Adductor of thumb, these are 2 in number. Lumbricals count for 4. Interossei count for 8. If we total them, they are 20. Alright, so muscles of the hand are responsible for the skilled movements, for the fine movements, for gripping. Okay, so let's discuss the thenar muscles. In this video, I'll be talking in detail about this muscle. Thenar muscles, as I told you earlier, that they are 3 in number. They lie at the base of the thumb. So this is my thumb. The thenar muscles lie at the base of the thumb. Alright. Now the hypothenar muscles. Hypothenar muscles lie at the base of the little finger. Okay. Adductor of thumb lies in the palm. Lumbricals associated with each finger. Now what are lumbricals? What are adductors of thumb? All of these muscles I'll be discussing step by step in next videos. In today's, my focus is on the this thenar muscles. So let's discuss this muscle one by one. The very first muscle is your Flexor Pollicis Brevis. Now, as I told you that there are 3 muscles, we can remember this by a mnemonic FAO. F goes for Flexor Pollicis Brevis. A goes for Adductor Pollicis Brevis. O goes for Opponens Pollicis. Okay, so let's discuss about the Flexor Pollicis Brevis. Now this muscle has 2 heads. One, the superficial head, another one, the deep head. The superficial head originates, now this muscle which is green in color is referred to as the Flexor Pollicis Brevis. Remember, whenever the word pollicis comes, that refers to thumb, and whenever the word brevis comes, that means short. So pollicis means thumb and brevis means short. Okay, so a muscle that is short and lies in your thumb is called as a Flexor Pollicis Brevis, having a function called the flexion of the thumb. Okay, now the superficial head, this yellow is a flexor retinaculum. The muscle comes from the flexor retinaculum, the superficial head, and the deep head comes from the trapezoid and the capitate. This muscle coming from the flexor retinaculum and trapezoid and capitate goes and inserts into the base of the proximal phalanx. So this is the proximal phalanx, this is the distal phalanx. The muscle is originating and inserting onto the base of the proximal phalanx. Now, the action of this muscle is the flexion of the thumb. The nerve supply is the median nerve. Remember, all the thenar muscles, example, all the 3 muscles, the thenar muscles, are supplied by the median nerve. I repeat again, by the median nerve. Alright, so the next muscle, which is the Abductor Pollicis Brevis. As the name suggests, abductor pollicis brevis, right? So abductor refers to the action, yani abduction. Pollicis refers to the thumb, and brevis refers to the short. Now origin. This muscle originates from the tubercle of the scaphoid and the trapezium. So this is your scaphoid. In the last video I have discussed about the carpal bones in detail, so you guys can check on that video. This is scaphoid, this is lunate, this is triquetrum, and this is the pisiform. This is the first row of the carpal bones. Now this muscle abductor pollicis brevis is going from the scaphoid and the trapezium to the base of the proximal phalanx. And which action this muscle is performing? This is performing the abduction of the thumb. So this movement is called as the abduction of the thumb. When the thumb is going away from the other fingers, that is referred to as the abduction. Again, the nerve supply is the median nerve. Now, the last muscle and the most deepest among all the three muscles is called as the opponens pollicis. Now, as the name suggests, opponens means opposition of the thumb. So this motion is called as the opposition of the thumb. Alright, so this muscle originates again from the flexor retinaculum and the crust of the trapezium. From the crust of the trapezium, this muscle is going, this orange color muscle is going and inserting onto the lateral side of the first metacarpal. So remember, we have 5 metacarpals. The first metacarpal is the one which goes to your thumb. The lateral side, this muscle goes and inserts onto the lateral side of the first metacarpal. Again, the nerve supply is the median nerve. This all for this video. Remember, 3 muscles, mnemonic FAO. F, flexor pollicis brevis, the muscle that is green in color. Okay, next A, abductor pollicis brevis, action abduction, the muscle which is blue in color. And the last muscle O, opponens pollicis, the muscle which is the deepest among the all and performs the movement called the opposition. This muscle originates at the this trapezoid and flexor retinaculum and inserts onto the lateral side of the first metacarpal. Thank you, and do like, share and subscribe to my video.